And I think Mr. Bedeker brought up really the primary point. It's the funding thing that ends up being a sticking point, and I think sometimes racetracks lose sight of the fact that we lose fans every day with breakdowns, and this whole entire summit is about addressing, trying to reduce breakdowns, trying to reduce human injuries, trying to reduce horse industry injuries. So I think the more the racetracks can come together to support this kind of research and advancement, the better off we'll all be. So now let's move forward. We've got a interesting one-on-one with Dr. Larry Bramlage, led by Ed Bowen, president of the Grayson Jockey Club Research Foundation. And you guys all know Ed Bowen. We've seen him for years. We've seen him here quite a lot today, but I want to offer a little bit of background on Mr. Bowen. He became president of the Grayson Jockey Club Research Foundation in 1994. Prior to that, he was a writer in the thoroughbred racing industry and a journalist since 1963. And I'm old, I'm 49, okay, maybe not as old as some of you, but that was before I was born. So Ed's been actively involved with this industry for a very, very long time. He worked the majority of those years for the Blood Horse and was editor-in-chief of that publication from 1987 through 1991. He also has had stints as editor-in-chief of Thoroughbred Times and Canadian Horse Magazine. Bowen is the author of 19 books on racing, 19 books, including biographies of Man of War and Nashua, the Jockey Club's illustrated history of the thoroughbred racing in America, and Masters of the Turf. He also wrote the script for a one-hour television show on Bill Shoemaker, wrote John Forsyth's script for the Eclipse Awards dinner annually from 1976 through 1998, and is himself an Eclipse Award winner. He's received the Kentucky Thoroughbred Association's Charles Engelhardt Award, the National Turf Riders Association Walter Haight Award, Pimlico's Old Hilltopper Award, and the Ocala-Marion County Chamber of Commerce Magazine Award. Bowen is a trustee of the National Museum of Racing and chairman of its Hall of Fame nominating committee and president of the American Academy of Equine Art. Mr. Bowen is also a former board member of the Thoroughbred Retirement Foundation and a past president of the Thoroughbred Club of America. He attended the University of Florida and the University of Kentucky. Mr. Bowen.
Thank you very much, Donna. As you can see, we're being joined by Dr. Larry Bramlage. I will be given ad hoc introduction. Dr. Bramlage is the go-to guy if people have injuries. He is much decorated as a distinguished veterinarian. And got a cheat sheet here. I was going to let you get by without this, but here we go. Internationally recognized equine orthopedic surgeon. Received his degree in science from The Ohio State University in 1978 and holds a diploma of the American College of Veterinary Surgery. He is past president of the American Association of Equine Practitioners and of the American College of Veterinary Surgeons. In recognition of his dedication and contribution to thoroughbred racing, Dr. Bramlage was awarded the 1994 Jockey Club Medal for contributions. He also was past chairman of the Research Advisory Committee of the Grayson Foundation, Grayson Foundation. He was the founding chairman of that organization and serves as the board of directors of the Grayson Foundation. His additional honors include the 1997 Tierlink Hawkmoor Prize for his work regarding international fixation of fractures, the 1998 Alumnus Award from the Ohio State University, Alumni Fellow Award from Kansas State University, a British Equine Veterinary Association Special Award of Merit, and the American College of Veterinary Surgeons Legends Award for the development of the fetlock arthrodesis procedure for horses in 2000. And he was a Thoroughbred Club Testimonial Award winner in 2014. Dr. Bramlage has received the AAEP Distinguished Service Award twice. He was elected to membership of the Jockey Club in 2002 and to distinguished lifetime membership of the AAEP practitioners in 2001. So today I'm going to join Dr. Bramlage in an informal setting. Over the years, at the foundation, I've had a chance to interview Dr. Bramlage, and most of what I know about bone, I learned from him, and it's a fascinating subject. I always remember my father saying, why don't they let the bones get set before they race them? And that's a prevailing concern, I think.
Is this working? Larry, we were talking a lot about continuing education, and it reminded me as recently as 2012 when the committee was appointed to look into the situation of fatalities at Aqueduct. Dr. Scolay told me that when they instituted a program of discussing and examining, investigating injuries, there was a case where a trainer was stunned when she told him that he had not really done a good thing for the horse by waiting till he was 4. He thought that, like my father might have said, let their bones get set. So I think it's a great illustration that years and years after published works that show that training and racing 2-year-olds does not hurt their careers, that the fact that that is still not widely known or universally known is an illustration of what we're facing with the need of continuing education. So for the 100th time, could you just sort of go through how a 2-year-old's skeletal responds and why it is not only appropriate, but ultimately helpful if the horse has activity at 2?
Well, first of all, thanks for the introduction. That was nice. We've talked about it over and over, and we saw data again this morning that shows that horses that start racing at 2 have longer careers, more successful careers, and fewer fatal injuries than horses that start at a later date. And one of the things that I think somewhat perpetuates this is the other breeds tend to wait longer before they start training and racing, or training and showing primarily, than do the thoroughbred racehorses. But if you're looking at the physiology of bone, bone requires a lot more in the horse than does the other organ systems, and we're going to get to that in a minute. But if you're looking at the physiology of bone, especially in the thoroughbred racehorse, the musculoskeletal system, the skeleton of the horse, is literally molded to the work that it's got to do. So the horse is not born with a racehorse skeleton. We talked about it in 2012 at some length, that the dorsal cortex, or the front cortex of the cannon bone, the place where they buck their shins, that triples in size. And it triples in size in response to work. The posterior cortex, or the back cortex of the tibia, which is the bone between the stifle and the hock, that doubles in size. It has to do that by responding to what the horse is doing. And that response requires a population of cells and a blood supply that has to be present in order to create that response. So it makes no sense to allow that blood supply and that cell population to totally atrophy after the horse finishes growing and then have to recreate it all over again. It means that you've got to redo something that is a much slower process and requires a lot more of the horse, takes a longer period of time to produce the infrastructure, so to speak, to respond to training. What you want to do is to catch that cell population and blood supply right at the end of growth, because it's all there to contribute for a horse's growth. It's contributing to the horse's phenotype, or their genetic predisposition for what their skeleton looks like while the horse is growing. We select for that with our breeding. But that doesn't get you the racehorse skeleton. You got to train the horse into the racehorse skeleton. If you pick them up at the end of their growth period, which is roughly 20 to 22 months in fillies and 22 to 24 months in the colt, to where their significant height in their lower legs. We're talking about just mostly the lower legs now. Interestingly, the withers grow until they're 13 or 14 years old, and why that is, I haven't got a clue. But in the lower limb, they pretty much have their end result height at that period of time. And it's the lower limb that has to make the most adaptation for a yearling racehorse to become a 2-year-old or 3-year-old or an adult racehorse. So the reason they do that much better is at the end of growth, you know, they'll finish growing in the distal radius, which is the growth plate that's right above the carpus at around 2 years of age, but it's slowing down and the system is atrophying as they quit significant growth. You want to pick that back up as a 2-year-old and give it another reason to produce bone or to modify bone or to make the bone stronger or to change the shape of the bone. Different bones in different sites require different things. I said the cannon bone thickens in front, the tibia thickens behind. It's because of how they're loaded. And it's a real interesting system as to how the bone responds. But the reason 2-year-olds do better is they have the blood supply and the cell population already there from growth. You don't want to let that get away. That's why you train them as 2-year-olds.
Thank you. You've always used the phrase microfractures. Can you sort of tell us what that means and how it fits into the process of getting a horse ready to be a racehorse and maintaining racing form?
Well, the bone responds to overload. Any training, whether you're talking about the heart, the lungs, the muscles, the bones, is trained through a system of overload, over-repair. It gets stronger. And then you overload it again, and then the body responds by over-repairing. Over-repairing is defined in different ways in different organ systems. For instance, the muscles in general in a thoroughbred racehorse don't get hugely bigger with training. They get some bigger. What happens with them principally is their enzyme systems change. The heart gets some bigger, but the heart can't get real big. Cardiomegaly is a disease, meaning that if the heart gets tremendously bigger, the heart gets faster. Its free wall speed increases in their ability to contract quickly. Those are responses to training. The liver enzyme systems increase in order to utilize the energy, and the muscles become better adapted at handling oxygen. Racehorses get a huge boost in their red blood cell circulating volume with training. So all of those systems respond. The way bone responds is with microfractures. You overload the bone, and the key is you have to overload it a little, and then it has to over-repair, and then you have to overload it a little, and it has to over-repair. If it gets behind in the repair, those microfractures begin to accumulate. Then that weakens the bone, and then it's a stepwise process to where you might get a frank gross fracture instead of just the microfracture. But microfractures are the damage that's done to bone in order to make it to get stronger.
In an interview we did once, you made reference to the innate sense that a trainer needs. Are there any new developments, or can you see new developments on the horizon that would augment that innate sense and perhaps be useful to a trainer who just didn't quite have that innate sense? Are there new tools out there in the last 12 years or so that might help?
I don't know that there is. The biggest new tool is what we're all about here today, and that is disseminating the education for people to use. But you know, asking a veterinarian how to train a racehorse is pretty dangerous. The one thing that I haven't succumbed to is trying to train my own racehorses. So it's fascinating to me that trainers, that many of them have a sense as to where to go with a horse and how to push them to fitness without pushing them to injury. And I think what most of those trainers have in common, this is just an observation, there's no science behind this whatsoever, is they understand when a horse is happy. They seem to be able to sense that horses like to train when they're fit. When a horse starts not liking to train, there's something going on. But the trainers who are really good at that can sense when those horses are thriving and doing well, and how they do it, I really have no idea. You're asking the wrong person. But there are certain things that we can do and that we begin to understand. One of them being, I think trainers are much more in tune now with better diagnostic systems and the moving forward of the electronic technology of understanding what is maybe the single most important scenario, and that's to recognize that lameness is not their enemy. It's a sign that there's something going wrong. Because if you're a trainer and your horse becomes lame, you can't train him. So many of them, and kind of the view in the past is lameness is the enemy, get rid of the lameness. The ones that are the best at training horses and having them have long careers is they recognize the lameness as a sign that the musculoskeletal system is getting behind, whether it's a joint or a shin or something in the horse is not keeping up with the process. And it's as we've talked about many times, part of the problem is the horse's heart and lungs so wonderful. You can throw so much training at a horse's heart and lungs that you almost can't overload them. They're so good at, they breathe passively. We expend 15% of our energy when we're running. I barely remember when I used to run, but 15% of your energy is expended in breathing. A horse has to expend almost nothing because they're so wonderfully made. Whether you believe in evolution or the hand of God, or whether they're both the same thing, I'm not, they could well be. A horse collapses his lungs when he brings his feet together, when he brings his legs together, and he expands them when he stretches out to take the next stride. He doesn't have to expend any energy in his intercostal muscles because he breathes almost totally passively. Because of that, they're obligate breathers, and they must inspire with a huge negative pressure whenever they extend their legs, and that leads to the problem of pulmonary hemorrhage in some instances. But they're so economically made, and they're so wonderfully adaptive that the musculoskeletal system is the one that takes the most adaptation. And it's like building a car, because you could cross a draft horse with a thoroughbred and you'd get a musculoskeletal system that's much more likely to stand training, but it wouldn't be able to go very fast. And so if you look at the skeleton as dead weight, it's the obligatory support system that the horse has to carry around the racetrack. It adds nothing to his speed. The skeleton doesn't give him more energy or push more oxygen or make him any stronger. It just carries him around the racetrack. So the lighter you can make that skeleton, the less weight the horse has to carry, and the faster he's going to be. And that's the beauty of the thoroughbred racehorse. And also, it's also the obligation of, we have put such a good engine in those horses with selective breeding for their heart, lungs, and muscular capacity, that we now have to train their musculoskeletal system carefully. I'm talking about evolutionarily over the years. Whether that has reached its limit is a totally other subject, which we've talked about once or twice before. Are we reaching the end game or not?
All right, thank you. Here's a quote from a recent article by Emma Adam. Remarkably, bone is both strong and pliable. This apparent contradiction occurs as a result of a critical balance between the mineral, calcium, and organic collagen and chondroitin sulfate. An increase in mineral content can make the bone stronger, but may also make the bone increasingly brittle. What would you say is the process, and is there a warning if the bone is getting to be, quote, so strong that it's it's brittle and perhaps needs rest?
Lameness. Yeah, I mean, that's the one you look for. I think you have to separate the different sites in the bone in order to understand that quote. In most of the skeleton, in the long bones, and we're talking about the tibia, the cannon bones, the long bones of the horse, any bone that has a hollow middle, you can make it stronger by just adding size to it. And you also increase the strength by increasing what's called the moment of inertia. The farther you make that material from the center of where it's going to be bent. Horses' bones are all bent. The cannon bone bends backwards. The tibia bends forwards whenever in the full gallop. It would seem hard to think that a horse's cannon bone bends backwards, but if you look a horse in a wind picture at the end of a race, you can see that whole limb bends backwards. And they bend backwards, and that's why the back cortex in a horse never gets thicker after they're a yearling, because it's not loaded in compression. Compression causes the microfractures, which cause the bone to get stronger. And it's the places where the microfractures occur that the bone gets thicker. But in a long bone, all the horse has to do is add more bone. That's a relatively simple process. They just make the cannon bone bigger, and they move the moment of inertia away from the loading center. That's why if you also look at a horse's cannon bone, it's in the front, it's not perfectly symmetrical. The inside cortex is much thicker than the outside cortex because it's the one that's loaded the most when we're galloping, and we do the most galloping, so that's why the horse gets thick there. If you're talking about a joint, the horse can't add more bone because the joint anatomy is obligatory. You can't make the cannon bone bigger because then it no longer fits the long pastern bone in the fetlock joint, and it won't fit the sesamoids. They can't grow the joint bigger, so they got to make the material stronger. There's only two ways to make bone stronger. You either make it bigger or you change the material till it's stronger. And that's where the bones get denser and denser and denser to where they approach something like porcelain. A normal distal cannon bone is trabecular. It's got a lot of lacy-looking bone on the inside, and those little spicules of bone are oriented against where the load is applied. If you need additional strength, a horse only has one option. They fill in those little spaces. And so the bottom of the cannon bone becomes stiffer and stiffer and stiffer. So then it becomes more brittle. Then it becomes less flexible. And then it bruises easier. And that's why the diagnosis of the whatever this 10-year period of time from 2010 to 2020, the diagnosis de jour, or whatever the 10 would be, that's your area, you're the writer, is bone bruising. We didn't used to talk about that too much, and we talk about it all the time. First of all, we can diagnose it better now than we used to because we have the digital radiography, the nuclear scintigraphy, the MRIs, and the things to look at, so we understand the physiology better than we used to. But like all diagnoses and all treatments in veterinary medicine, there's a cycle that it goes through. We learn something happens, or we learn that something works, so we'll use it on a few things. And then when we realize it works, we use it on everything. That's the diagnosis of bone bruising. We learned that it was there, so now we call everything bone bruising. So slowly we're coming down, and like all treatments, we'll seek the right level eventually, and maybe by 2020 we'll truly understand that terminology. But when the bone becomes brittle, it's less flexible. So if it can't absorb the load by its structure, then it becomes insulted, and it gets what we call bruised, which is actually inflammation of the bottom of the bone, which for the most part is the accumulation of those little micro loads faster than that bone can adapt or in some instances, like in the third carpal bone in the knee, or sometimes the structure becomes so deranged to where it has a difficult time handling that load. And so actually some horses do get to the point where they're very difficult to train, but that's pretty rare. That's impossible. It's more common. It's actually more common in the carpus than it is in the distal cannon bone. They don't get so strong you can't train them. They do get so strong that they sometimes become vulnerable to the pounding, and that's what we have to do.
When you said that it sometimes gets like porcelain, would that indicate that it is subject to what happens to porcelain? Would that put the horse more in danger of a major fracture?
Absolutely. Fractures propagate through porcelain. You know, you can have a coffee cup that's got a crack in it for a long time, and then one day you hit it just right and the thing falls apart. That's because porcelain's a very brittle substance. Same thing happens to some degree to the distal cannon bone with a horse with a condylar fracture. And you know, we've moved all the way from the horse took a bad step to we know this horse had pre-existing injuries, and so that's why he gets injured. I'm in between someplace. I think we have to give some credit, like Mick's been talking about, to the horse's footing. And therefore, I believe, and therein, I believe, lies the explanation for why consistently the injury rate is lower on artificial surfaces. It's because it's more consistent. Those horses are carrying around those little nicks and dings within their skeleton all the time because they're getting those with the work they do, and then they're repairing them over time. And most of the time, they stay ahead of everything that we do. Some horses are have an easier time doing it than others. So some horses you can throw anything at them and they can stand it. Some horses you can't train at all because they can't stand anything. But for the most part, they're carrying those problems with them, and they overcome them in spite of us. However, if we predispose them to having those nicks and cracks in their bones by not recognizing them that they're not thriving in training, and then they hit an irregular area in the racetrack, the same thing happens to that cannon bone as happens to your porcelain coffee cup, is that it propagates because it's a more brittle substance than the, for instance, untrained bone or less heavily trained bone. The more brittle you get, the more like porcelain the bone behaves. And so it has to be a combination of an unexpected load. One of the easy ways to understand that is if you watch a runner running down the side of the road, they prefer to run on the asphalt. It's less dangerous to run in that space between the sidewalks and the curb because the drivers aren't going to come close to you when they're driving. But you can't run there because you're going over grass, concrete, bricks. Your footing's changing all the time, and it hurts, like stepping off a curb when you don't expect it. Same effect if you hit a hole in the racetrack. And dirt racetracks, you have a harder time keeping the base consistent, whereas artificial surfaces are 7 inches or so deep of the same substance. So if the horse in the two-path gets down into the surface a little ways, he's less likely to hit an irregular spot in the base because he's got more material to work with. And I think that, therefore, explains the lesser injury rate on artificial surfaces because it's more consistent and it doesn't make those little nicks and dings that the California horse racing program has documented. It doesn't make them into the propagating cracks.
Well, I believe you've had the philosophy that a horse can really benefit from a rest every now and then, and you zeroed in once to talking about it, saying 2 months was kind of the optimal break. Am I remembering that correctly? And if so, what's the explanation of 2 months being right for the rank and file horse?
Well, we think that that's about right. There's a couple of reasons why we arrived at that scenario. One of them being if you're just healing a fracture, it takes about 2 months for the process to complete. That is, once you make the fracture stable, whether you put screws in it or whether you just, sometimes you can make a fracture stable by just take them out of training, quit pounding it. If you can make the fracture stable, then those cutting cones that Rick showed, they go across the fracture and bridge the thing across, and then it starts the remodeling process. You don't have to wait for the fracture to totally remodel, because you actually want it to remodel to racing. You don't want it to remodel for a broodmare. That's why you don't want to put them in the field any longer than you have to. The other reasons that we think 2 months is about the right time frame is if you look at the cardiovascular system, where the exercise physiologists have looked at it to see how long it takes for the horse to start detraining, it's about 5 weeks or so. So we don't want to go much longer than that if we don't have to, because then you have a lot more miles to put in the horse to get his heart and lungs back to where you want them, and then those miles become wear and tear on the musculoskeletal system. When a horse is off for a long time, they don't have the input to keep the bones strong, especially if they're stalled. Bone's very dynamic. It only stays, that's what made Julius Wolff famous in the 1890s. He's the guy who described Wolff's Law, which we all learned whenever we were in veterinary school, and that is bone is laid down where it's needed and is taken away where it's not needed. It's actually just an observation. It's not a law that he made, but he was smart enough to write it down. He wrote it in German. But he was the first one that made that observation, and it really is true that the bone only stays as strong as it has to stay. I don't want to get too many sidetracks, but some years ago we looked at anesthetic incidents and to what the risk of general anesthesia was in our population. The number one risk is an older broodmare that's had multiple foals, that's not very athletic, and that's fatigued. She's either been through dystocia or a bad colic episode or something. So you put all those things together, and the most common thing that happens in this day and age with anesthetic risk is that old mare breaking her tibia. They get up, they don't break it when they fall. They push themselves off. They're exhausted. They're not very athletic. They're heavy. They've nursed a lot of foals, and they don't do enough in the field to keep their tibia strong like it was whenever they were racehorses. Racehorses, if they don't have a tibial stress fracture, I've never seen them break a tibia. If they happen to fall, they can break something else, but they really don't break the tibia. But those old broodmares do, because they have no input to keep that bone stronger. There's good evidence. Again, this is, I believe it's from the California Racing Program, where one of Sue's graduate students looked at the layoff time period before a horse was diagnosed with a tibial stress fracture. If you pass 4 months, your incidence of tibial stress fractures goes up. And it really makes sense, because those are the horses with those holes in it. Nothing's been telling that tibia to stay strong, because especially if you got the horse in the stall. I'm a person for trying to get them out of the stall as much as I can, as fast as I can, because if they're in the field, it not only is better for their blood supply for healing bone, but they're also moving around. They're loading the bone and unloading it, so it stalls that process of removing bone where it's not needed. So that's a whole lot of different stories coming to the conclusion that we believe that you can lay a horse off for 2 months without much penalty. Once you get between 2 and 4 months, you start losing strength in the bone because of those remodeling cones that go through, because they can remove bone faster than they can remake it. And then once you get past 4 months, the penalty's pretty high.
I know you don't want to be talked to as a horse trainer, but if you think back to cases you've had, do you have a sense that you get a pattern of injuries that are partially caused by the trainer's lack of understanding about what you've just said? If you're trying to bring a horse back after 4 months, do you find that you have any cases of a horse that you can tell from his record that he came back, you can surmise that he was brushed back a little bit more than the bone was ready?
Yes.
Okay, good. I'll let you off with that.
I'll tell you the one that I hate to see. If I hate the trainers, hear a trainer say, well, we're going to give him a rest. We're not going to take him to the track. We're just going to keep him in the shed row and tack walk him for 6 weeks. I think you can almost put an X through that horse. That does not work. Because what you have then is so little input for that horse to keep his bones strong. He's not, if they're turned out in the field, at least they're moving around. Plus, there's a huge advantage for a horse being in the field. Horses evolved as grazing animals. One of the problems we have with how we have to train them is we train them intensely for an hour, and then we put them in the stall for 23 hours. Or we might walk them in the afternoon, which is actually a good thing. If you walk them in the afternoon, you get them out. What happens then is the horse stocks up. So we put stall bandages on him to keep him from stocking up. But we're treating the result, not the cause. The cause is the fact that because a horse evolved as a grazing animal, their circulation works the best when they're walking around. If you watch a horse graze, they don't graze, they might probably in a night's time eat as much grass as this spot that we're sitting on. But they don't graze in a spot like this. They graze the entire field. They'll eat 3 or 4 bites and they walk 3 or 4 steps, and they eat 3 or 4 bites and they walk 3 or 4 steps. That's how a horse's blood flow works the best. They don't even have valves in their lower limb. That's why they stock up whenever we put them in the stall, and why we got to put stall bandages on. Their circulation depends upon movement. So their support system for repairing bone bruises depends upon movement. A lot of the problems we get with the musculoskeletal system and the problems we have with the bones is related to the fact that they have to stand still for so long. They don't have the good blood flow support system that they need. So the treatment for a lot of bone bruising is put them in the field. This was about, 4 or 5 years ago. Travis Tull, one of our graduate students, he was one of our interns and then a resident then, was interested. We looked at the paper did a paper on the effect of turning horses out in the field when we had diagnosed distal cannon bone bruising as a problem. Now, we didn't take any horses. These bruises, if you keep pounding on them, some of them will go into condylar fractures. It's not the only cause of condylar fracture, but it's one of the mechanisms that leads to a condylar fracture. And so we didn't include any horses that had fractures that required screws, but if they had little bitty short fractures or just the radiographic bruising, and we sorted them, and we wrote the paper according to the reviewers. They had to have a bone scan, they had to have radiographic changes, they had to be blocked, and we knew the pain was there. They couldn't have any other lameness superimposed on top of it. It had to be a singular problem, because we wanted to know if this is the only problem the horse had, how effective was putting the horse in the field versus keeping the horse in the stall. There were 2 previous papers on treating bone bruising of the distal cannon bone diagnosed with nuclear scintigraphy. One of them had a 60% reoccurrence rate, and one of them had a 40% reoccurrence rate, and they were receiving various medications along with stall rest and hand walking. When we put this group of horses, we sorted through 452 horses and got 55 horses that had all of those criteria and nothing else. So they had no interfering other conditions, and they had as much as we can make it, an irrefutable diagnosis. That's exactly what they had. 95% of those horses came back and raced because they were turned in the field. We just tell the owners, get them out in the field for as many hours a day as you possibly can. Ideally, you let them graze. Now, this has been discussed and refuted. The other end of the spectrum, doesn't work if the horse goes so far into bone bruising that he actually changes the shape of his bone. If you bruise a bone bad enough, the reason we can see bruising on the radiographs is the minerals absorbed. If you bruise it bad enough that it loses enough minerals that you begin to push in the back of the cannon bone, it's no longer perfectly round like the bottom of a cannon bone is. It begins to get a flat spot. Those horses are never the same. You have to get them before they either get an unstable fracture or before they begin to lose the normal shape of their bone. Then it's very effective to get them out, let them move around like a horse. It took 3/4 of them 60 days to get normal radiographs and all the lameness to disappear. 1/4 of them required some portion of 90 days. Not all of them got all of 90 days. But when they went back, 95% of them raced. And the important factor was when we looked at their success rate, they earned just as much money after surgery as they earned before. They were just as effective after surgery as before. Now, they didn't earn as much per start, but that's an effect of how we race horses, because the entry-limited per supplemented races are 2 and early 3-year-olds. So they were earning less per average start, but they made more starts after they got over the bone bruising, and their average earnings were statistically equal. So the idea that you can handle a horse without paying attention to how their bone remodels is a real one, and some trainers do have a much better handle on that as far as how to train the horse, and most times it's reading the horse because they're not all the same.
I'm reminded of a comment that a researcher, David Nunemaker, made years ago. He said, standardbreds are trained to race, thoroughbreds are trained to train. And even though it is true that in the past there were more instances of a horse being worked the distance he was going to race, it's always been my general pattern that horses have long gallops and short breezes, and then they race a distance. They're expected to race at 1 1/8 miles, say, when they haven't been worked that way. What do you have any observations about whether that is a pattern that could be improved upon, just as a generality?
Well, I think Dave improved us already with some of the observations that he made. He was the person that really explained to most of us that the horse doesn't bend backwards as far when he's galloping as he does whenever he's working or when he's racing. So in other words, the appearance of that leg in the wind picture with it bending very far back, that doesn't happen as much when they're galloping. They stay pretty much straight up and down, and they load the inside half of the cannon bone heavier than they load the outside. But as soon as you breeze them or make them go faster, they start loading the outside heavier. So when you look at the bend in the cannon bone, it tends to load the outside more than the inside. It also the left leg gets more heavily loaded because we race left-handed than does the right leg. And so that's why the stress fractures on the horse's shin are almost always 90% on the left forelimb and almost always outside of center, because we haven't actually shown that bone what it's going to need, because we don't breeze them as many times. We don't breeze them as frequently and with shorter breezes than I think what we used to. And we went through a period where we had this idea that if you were going to buck a horse's shins, we bucked them good. We would go out and they'd gallop the devil out of them so they got really sore, thinking that that's good for the horse. After Dave's work, most people understand that sore shins is part of the physiology of making the horse a stronger shin. And if you just stop and turn him out, when you come back to that same period, you got to go through the same thing again, because he hasn't made his shin any stronger. So I think most trainers now have a better handle on the scenario that the line you want to walk is the horse should be sound, but his shin should be tender whenever you touch him. In a young 2-year-old training, so there's nothing wrong with the shin being tender. That's why that means he's making more shin. If the shins are not tender at all, it's taking him forever to produce a racehorse cannon bone. So a little tenderness in the shin, That's probably where you want to be. If it starts to get out of hand, you're training too fast, you got to slow down. If there's no tenderness whatsoever, you're probably not going fast enough in a 2-year-old to produce a skeleton. So he was the person who kind of gave us the concept that you must train the bone. The effect of producing a racehorse skeleton is work specific. You must train the bone in the fashion at which you're going to race it in order to make the skeleton ready to race it in that fashion. And then shortly after that, there was a paper from England that's really interesting. It was done on turkeys, but you can transpose, I think, this because it fits very effectively with the horses. They put turkeys in a vise, and some of them had to flap their wings to get fed, and some of them flapped 2 times and they'd get fed, and some of them had to flap 4 times. Some of them had to flap 8, 16, up to 2,000 times in order to get their food, because they wanted to see where the input on bone, and effectively, even though it's birds, the microstructure of the bones is very similar. And the work is I'm convinced, is definitely transposable, because it's one of the, there are a few of these papers that people do that you think, well, that's a great idea. Why didn't I think of that? I wish I had been the person that discovered that. But they figured out that bone continued to get stronger up until 36 cycles a day, 36 cycles in a 24-hour period. After that 36 cycles, it didn't get any stronger. Didn't matter how many times you cycled that bone. The bone couldn't respond any more than that. So if you transpose that effective, and where all this was leading is, if you want to look at stress fractures and all the literature in the world about what's happening to stress fractures, you go to the Israeli army recruits. All the good papers are written on preventing shin fractures in untrained army recruits in the Israeli army. First of all, there's a lot of them. Second of all, they keep good records about them. And a lot of the stuff that's known is all produced out of that laboratory, so to speak. Well, this research was feeding into that scenario, and they learned in the training of the Army recruits that you could train at a higher level, but if you train in too high a volume, then it's hard on the bone. So really, if you look at how much 36 cycles is in a racehorse, it's about not quite a furlong and a half. And once you go a furlong and a half, that signals the bone at the highest level how strong it needs to get. Creates the microfractures that creates the thickening, how strong it needs to get. When you go beyond that, it's just wear and tear. So that's why breezes in that level train the skeleton the best. Now, if you train only the skeleton, you go broke, because you got to train the heart, lungs, muscles, and they require volume of work. So that's why it's not a simple task for a horse trainer to just say, I'm going to make the skeleton strong, but because then he's got a horse that can't compete. You have to train all these other systems, the heart, the lungs, the muscles, make their enzyme system strong. They train to volumes of work. The bone trains to level of work, and the highest 36 cycles is the level.
Thank you. Well, as Mrs. Brothers was kind to point out, I have been around quite a while. The good news is that means that I knew a gentleman named Hurst Jacobs, who was a great trainer, and he loved to say that they don't pay me to train, I'd rather race them. He would be appalled at the pattern of 6 starts per year now. Do you think that if Hurst Jacobs or someone like him came back or developed or read about him, do you think a horse could be trained like they used to, where you would get fit and then run every couple of weeks without it being detrimental either to the health of the horse or to his ability to operate at the top level? And I know you asked me not to talk to you like a trainer, but you got turkeys and soldiers into one conversation, so surely you can take on this.
Take on a trainer. Yes, but I think I do think that I'm not necessarily a believer that horses aren't as tough as they used to be. We handle them quite a lot differently, and I think Carl Nafzger made a statement one time that the biggest change in horse racing is the invention of the airplane. And if you think about it in terms of Citation's win streak in Chicago when he won, 16 in a row, or so? A couple years ago, 16. Yeah, 16. Why would you breeze him? I mean, back then, the purses weren't all that big, and the handicap system grew out of the need for equalizing horses that were in training in Chicago or in New York or wherever it is. Horses didn't move around like they move now. And so if you've got a Citation or you got a horse like that, why would you ever breeze him when you can take over and get a check every time that if you're trying to do that? He's the best horse in Chicago, and until they wade him through the track with the handicap system, he's going to win money when he goes every time. Right now, the economics of racing are such that horses are expected to compete when they go in the starting gate. So we breeze them many, many more times than they used to, because it's easier to scratch them out of the race than it used to be. I mean, like when I first went some to the race, I went until I was in college. It was kind of a dilemma. If you come up 30-1 in the morning line, you sort of wanted to scratch out, but it was a matter of I don't know if it's integrity or whatever. It was not something you just did. We allow people to scratch in and out of races and go to the next race with no problem anymore. It's because we're expected, the trainers are expected to compete when they go there. So they have to be much more conscious. Then, I don't know, what was it, 15 years ago, we started publishing the trainers' success rate in the program, or what some trainers will tell you my strike rate. I mean, I can't just give him a race. It'll hurt my strike rate in the program. So owners make decisions based upon how many times the trainer's in first, second, and third. That makes them even more likely to breeze more often, to wind that horse tighter before they put him in the race. The economics of racing have changed. When in 2009, when we looked at, this was in the presentation I did at the round table, and we took a whole bunch of the Jockey Club was nice enough to run the statistics. We took a look at these parameters, and we were trying to figure out whether horses were as tough as they used to be. One of the things we looked at is how many horses that make a start in the United States, or how many starts in the U.S., are contributed by horses that are 5 years old and older. And then we looked at it over time. I think the computerized records went back as far as 84, and we could only go up to like 2009 because we wanted the horses to be at least, if you're going to have a 5-year-old, and compare them to anything else, it takes a while for them to get to be 5 years old. So from 2005 to 1984, we looked at what percentage of the racing population starts had been made by horses that are 5 years old and older. It's amazingly consistent, about 30%, all the way across the board. If you're a talented older horse, you stay in the racing populations. The ones we got rid of, and the horse racing population has stayed relatively the same, gone down a fair amount recently, but stayed relatively the same in that period of time. But the number of racing opportunities went down since the 70s. The number of carded races that horses could compete in, so the number of racing opportunities went down. But where the winnowing out occurred is in horses with 1 to 2 starts. If they don't show talent, we don't keep them around, for the most part, as a general rule. The number of horses, and it's on the Jockey Club website. If you look at the number of starts contributed by horses that are 5 years old and older, it stays pretty much the same. Those old campaigners, they stick around. They're productive.
Now I want to switch subjects here. I was thinking the other day, going back to, it surprised me to think it's been back as far as 17 years ago. When Real Quiet won the Kentucky Derby, it generated a lot of discussion about correction of malformations in foals, because he was the sort of poster child for, I think, periosteal stripping. I don't read much about that anymore. What is the current, what is your current thinking on correcting foal deformities, limb deformities?
Shannon, can you put the picture of those horses back up here that you had up? Yeah, that one. I'm going to show you something. I saw this picture. Look at this horse's knee. If you look at that horse's knee, first of all, to answer your question is, I don't think we've changed a whole lot. The topic just changed. People don't talk about it as much anymore. But this horse has a badly offset knee. Offset knees occur at the radial carpal joint. Offset knees, by definition, the carpus and the cannon bone move out from the radius, moves out this direction. So he's really offset. And in this picture, you can't see, and no other horse is exactly on the lead, but this horse has a pretty much valgus, slightly valgus conformation. This one is a little more valgus, meaning knock-kneed, a little more knock-kneed. And the one that's like second from the rail, he's got his legs in a position that's fairly straight. This horse is unsound unless he's knock-kneed. Because if he has a perfectly straight limb, this leg, the lower limb, sits out so far that when he loads it, it bows out when he loads it. And you can watch yearlings do that when you watch them walk on the sale pavilion, or watch them walk in the barn. This is a protective conformation for that offset knee. If they're knock-kneed and you draw a line from his elbow to his fetlock joint, the weight passes right through the middle of the knee. If he's bow-legged, or even if he's perfectly straight, the weight passes through the inside of the knee. And those of you that are horsemen in the audience know how difficult a chip fracture in the lower joint of the knee on the inside is to overcome. Many of those horses are never the same. So we talk about it less. We do some of the procedures less, and some of the procedures more often. Like, we're more likely to put a screw in an ankle than we are to do a periosteal transection. Periosteal transections work, but they only work a little compared to putting a screw in. So we still do reasonably the same number of transphyseal screws, and we make those corrections as well when we can. It helps the horses if you correct some of those conformations. Now, the advent of the agent has made us gone over the edge. And now this is my opinion, and so the agents in the room can strangle me when we walk out of here. The agent's criterion for buying a horse includes that they'll buy a good conformation. And if that horse is no good and he's well conformed, the owner can't say, well, you bought me a crooked horse, so he's no good. It used to be when trainers and owners, when John Ward and his owners went to the sale, they'd look at a horse and say, oh, he's a little crooked, but I think we can live with that. The agents don't have the ability to do that. They have more liability, so they demand a much straighter horse than I think we absolutely have to have. So there's a range of tolerance that you can stand, and the horse will still be sound. Bow-legged and offset knees is not one of them. You don't want that. You need to make them straighter. In that same 2009 presentation at the Jockey Club, we also looked at the percentage of named horses that, that's wrong. Percentage of sale horses, yearling sale horses, that started in a race, and 2-year-olds that started in a race, because we were trying to look at the scenario of does the process of prepping for a sale, 2-year-old or yearling racehorse, does it hurt the horse's chances to race? The percentage of horses that sell in a sale and then eventually race actually rose 8% from 2004 to the 2005 or 6, whenever we looked at That's the span of time we look for results. A higher percentage of horses raced. I think that's probably twofold. One of the big reasons I believe is the repository, because we used to try to live with some things that we probably shouldn't have. Like, for instance, chip fractures in hind ankles. There was a paper, a veterinary paper, that just looked at sales surveys and whether there were chip fractures in front ankles or hind ankles or hock OCDs or all these things, and see which ones affected the horse. For bruises in the back, his was the first paper that showed that hind limbs had a much higher percentage of problems than any other joint, and the hind ankles were most common. And then this was a follow-on paper, and it looked to see whether chip fractures in the front ankles or hind ankles made more difference to the horse. The paper said hind ankles affect the horse's performance, front ankles do not. Well, that makes no sense. No, but what was happening is this was before the repository. And whenever the trainers would buy the horses, they'd all get x-rayed after the sale. For a month, we'd be taking out front ankle chips, but we never took out hind ones. When the paper was done and just looked at on this same group of horses, just looked at ankle chips, it didn't account for how the horses were treated. And that's the difference between why the hind ankles affected them and the front ankles did not. We took out all the front ones. They used to get taken out before they go train, but we left all the hind ankles. The data shows those actually were reducing the horse's productivity because they were left in. Now, since that time with the repository, hind ankle chips get taken out because they sell better, and justifiably so, that they do, according to that data, affect the horse's performance. And that's why I think correcting angular deformities within reason helps the horse, and the repository has a positive effect on the ability of a horse to reach the races.
Thank you. Now we've got just a few minutes left. I promised I would get to the subject of bisphosphonates. To me, that's an example of a need for education. Can you talk us through that rather briefly?
You're going to get me shot. For those of you that don't know what bisphosphonates are, bisphosphonates are the drugs like Fosamax and those that ladies with postmenopausal osteoporosis take. And they keep those ladies' bones stronger. Now, interestingly, they don't keep them anywhere near as strong as exercise, which has to do something to do with what we've been talking about before. Exercise is by far the best, but if you're a sedentary middle-aged woman, you're likely to have osteoporosis in your vertebral column, and bisphosphonates slow that process. Now, they slow the process by poisoning one class of bone remodeling cells, the osteoclasts. Those osteoclasts are stimulated by two processes. One is commonly called stochastic remodeling, which is a fancy name for it. It's driven by trauma, meaning the trauma of training, and the reason that these horses that are laid off after going through a heavy period of training, they see the need to remove some of that bone that's been insulted by trauma, and then they only put it back in if they have the stimulus for training, like we're talking about, keeping them in training. That process is also driven by postmenopausal hormonal levels. And there's also a few other genetic diseases like Paget's disease, where the bone gets absorbed and replaced by fibrous tissue. So young children with that disease get bisphosphonates because the bone remodeling process is deranged, and so they want to slow that down. It poisons the osteoclasts and stops the bone remodeling. For postmenopausal women, that's fine. It also has another effect. It's given to people with bone tumors, bone metaplasia. If you have a metastatic tumor and it affects your bone, it's very painful. And it has a primary pain relieving effect. Nobody knows why that happens. The mechanism for that is not elucidated yet, but the cancer physicians, they use it a lot anytime you have a bone metastasis because they're, in general, not interested in the really long spectrum. They're trying to make that person's quality of life good because the metastasis is already going to be a terminal disease. So it has a primary pain-relieving effect. It also stops the cells that drive most of bone remodeling. It was approved for horses that are more than 4 years old for navicular disease, and there's one paper that shows that it has some effect on hocks, but it's been largely misused in veterinary medicine as a pain reliever and as the bone absorption drug. If you don't know why you're having bone absorption, I think you have to be careful using bisphosphonates. Bisphosphonates are long-lasting. The human physicians will tell you you have to worry about it for 2 years after a patient's been on it. Now, they tend to be on longer term, but not as high levels as we use in horses. That molecule goes to the surface of the bone and attaches, and it stays there for a long time. And any cell that eats that molecule, any osteoclast that eats that molecule is killed. So it has a primary pain-relieving effect. It slows bone absorption, but most of the time bone absorption in the young training athlete is adaptive. So I don't think we know what the effects of that are in the long term. And if you're just using it for the pain relief effect, it's probably not a good indication. So the jury's still out on the question that you asked. We're trying to figure out how dangerous this is or isn't. But in the young training horse, first of all, it's not labeled for the young training horse. So if you're a veterinarian and you're using it off-label, I would be afraid. I would be careful. And I've used it in horses, horses that have lesions that, we're talking about the bone bruising in the bottom of the cannon bone, and they might come home from the racetrack and they're really sore. And it's one way to slow down that remodeling that's being driven by the trauma the horse received in training until they get accommodated to paddock turnout, because most of those horses will eventually adapt. And it has a pain-relieving effect there. But I don't use it in young training horses.
Thank you. Well, as always, it's been a very it's been a very great time with Larry, and between the two of us, we have a pretty high intelligence average. And so, Donna, it's back to you.